listening to the Agent Survival Guide podcast. This is the Friday 5, our weekly recap of 5 things that happened this week that you should know about. And I'm your host, Sarah Ruppel. We start our list at number 5 this week with an update on the social media sphere. Last week, we talked through the increased users and app downloads for Threads and Bluesky. No doubt you've seen reports on both of those apps through this week as well. Just wanted to give a quick snapshot of where we are this week versus where we were at last week in the world of app downloads. For iOS, Bluesky continues to be at the top spot for app downloads, with Threads coming in at number 4, TikTok at number 8, and X at number 43. Last week at this time on the iOS charts, Bluesky was at number 1, Threads at number 2, TikTok was 5th, and X was at the 25th spot. So an interesting comparison there. Moving over to the Android side, also at number 1 this week, Bluesky, TikTok at number 3, Threads at number 4, and X at number 33. So more changes on the Apple side than on the Android side for this week. And I did want to get those numbers in this time around because, quite honestly, they can get a little wonky over the Thanksgiving holiday. And that's because for the kids in school, they need ways to communicate over the holidays while they're out of school, and they will find some creative ways to get around those screen time limits. But you also can see changes in social media app downloads as people discuss these new apps over their holiday dinners. And of course, we'll likely also see more downloads for travel apps, recipe apps, and shopping apps as we get through Thanksgiving and into Black Friday and Cyber Monday. Another cool thing I discovered that I'd like to share with you this week, just in case you are curious about Bluesky, and you're one of the many people who signed up over the past week. Probably one of the most time-consuming things about signing up for a new social media platform, discovery. Who do you follow and how do you find them? And there are a couple of different ways to find accounts to follow on Bluesky. One solution was a browser extension that compares accounts you follow on X and checks those accounts for matches on Bluesky by searching for matches in handle, username, and names that appear in their bio. A lot of accounts on X have posted their Bluesky username in their bio to make this a little bit easier. While this is an easy enough process, I can't run a web extension like that on my work computer. And to be honest, I'm becoming less and less of a fan of giving third-party apps my login credentials, especially for something like this that I can handle manually and have a much more secure experience. But there is another way to find and follow a lot of people all at once on Bluesky, and it comes through a project called the Bluesky Directory. On Bluesky, similar to X, users can create lists. These lists include people to follow, and by following a list, you also get a posts version of that list, which is a feed featuring posts from those accounts in reverse chronological order. The Bluesky directory simply allows for an easier search experience. So you can search for a starter pack around a specific topic, then click on it to go to the official Bluesky list. And you have the choice of whether to follow the entire list or just select people on it. I went through a few different lists and did that, either following people that I was familiar with their work or finding completely new people to follow. We will have the links to that resource in the episode notes, as well as a few articles about those starter packs, just in case you are talking about Bluesky in your newsletters. If not, at the very least, you'll be able to chime in about Bluesky as you're sitting with your family around the turkey this Thanksgiving. Number 4, on Wednesday this week, We published an episode featuring the apps our staff uses on a regular basis. I'll get the legal disclaimer out of the way here. The apps we mention aren't recommendations per se, and like other apps, you definitely download them at your own risk. The app that I use the most did not make the list, but I almost feel like it's one of those apps that we don't necessarily think of as an app. And that is the default Notes app that comes pre-installed on every Apple device. I have been in the Apple ecosystem a long time. I've had several Apple devices over the years. And the thing that I love about Notes is that it's like a running notebook that you can continually add to and access across devices. I have long notes that need to be scrolled through to get to the information I want. I have short notes because I use the app to create reminders for myself. And then for some, I need to search for certain keywords because they're more like Post-its than an actual notebook. So when I saw an article saying that Apple had confirmed a bug affecting Notes, causing some notes to go missing, I was torn for a second. Do I read the article or do I check my notes to make sure I haven't been affected? Well, I definitely checked my notes first, and everything looks okay. Super thankful for that. After I took a breath, I clicked into the article, and there is a solution for the bug. So no, your notes have not disappeared into the ether. You should be able to find them. Turns out that back in September, Apple made a change to their iCloud terms of service, and that might have been what caused the Notes app to no longer be synced. I'm an iCloud Plus subscriber, so I suspect that might be why I wasn't affected, but honestly, I can't be sure. Many of the people who reported the bug also remembered agreeing to the new iCloud terms of service prior to their notes going missing. So here's the fix. Simply go into your settings, scroll down and click on iCloud, then click on Notes. If the toggle to sync this iPhone or sync this iPad is not selected, tap it to turn on the sync feature. If you haven't been syncing your notes between devices, this tip might be a game changer for you. After you enable syncing to iCloud, go back and check your Notes app again to see if the missing notes have appeared. If they still haven't, restart your device and they should appear. We will be linking to a few articles detailing that process in the notes, as well as the official bug fix from Apple. If you're having trouble with an Apple Pencil connecting to your iPad after the iPad OS update, after the latest iPad OS update, I haven't heard of a fix for that just yet. I got around it by purchasing a USB-C Apple Pencil to use with my iPad. And since it's pretty much a digital notebook for me at this point, I can't not have that functionality. But I am keeping an eye out for a fix on that front, and I will report back when I find a solution. Number 3, we have talked about the Medicare drug price negotiation program previously here on the podcast. It's a story we've been following for quite some time, updating agents with the parameters of the program, drugs nominated for the program, and even what the savings will be on those drugs during the first year when it is implemented, coverage year 2026. KFF recently updated their collection of frequently asked questions about the program. You'll now find information about the second round of price negotiations, from info on timelines and drug identification, as well as information on the first round of drug negotiations. A lot of great information in that post, and these FAQs would make great content for your client newsletters. You could pop in the question and answer, of course, attributing it back to KFF, and then linking out to the full FAQ for those who want to dive a little deeper. Special thanks to our editor, Roxanne, for sending this over to my attention. Lately, our team's chat has been sending articles back and forth, oftentimes very early in the morning, as we discover that CMS or HHS has published something either late in the day or overnight. We do our best to keep each other informed so we can then take that information and get it out to you as soon as possible. Moving on to number 2. Couple of changes coming to Medicaid and CHIP thanks to 5 newly approved Section 1115 amendments. On Thursday last week, the Biden-Harris administration announced the new authorizations for Colorado, Hawaii, Minnesota, New York, and Pennsylvania. For a little bit of background, the Consolidated Appropriations Act of 2023 mandated that kids under the age of 19 with coverage through Medicaid and CHIP must have a period of continuous eligibility that lasts for 12 months. That is the base that we're working with. And in case you're wondering what a Section 1115 demonstration amendment is, I was too. So I followed my mom's ever helpful advice to look it up at Medicaid.gov. She would be so proud. Essentially, these demonstrations give states some flexibility in how they design their Medicaid programs. So that's another reason we see some differences from state to state. There are parameters around design, including that Section 1115 demonstration amendments must be budget neutral for the federal government. According to Medicaid.gov, budget neutral means, quote, during the course of the project, federal Medicaid expenditures will not be more than federal spending without the demonstration, end quote. So this is money the federal government would have been spending anyway. It's not costing any of these states anything extra to implement these amendments. First up, let's take a look at Colorado. For kids with Medicaid and CHIP coverage, they will now have continuous eligibility from birth till their 3rd birthday. And then for those aged 19 through 64 leaving incarceration, they will have 12 months of continuous Medicaid eligibility. In Hawaii, kids covered by Medicaid and CHIP will have continuous eligibility up till their 6th birthday. Individuals aged 19 through 64 leaving incarceration will get 12 months of continuous eligibility, but they must meet certain high-risk criteria. So, taking the specification one step further in Hawaii than in Colorado. Minnesota also added continuous eligibility for kids covered by CHIP and Medicaid up until their 6th birthday. And then for those aged 19 to age 21, they'll have 12 months of continuous eligibility. In New York, kids covered by CHIP and Medicaid will also have continuous eligibility up until their 6th birthday. And then Pennsylvania, the Section 1115 demonstration added continuous eligibility for kids with Medicaid and CHIP coverage up until their 6th birthday. And then mirroring Hawaii's post-incarceration rules, individuals age 19 through age 64 who are leaving incarceration and meet certain high-risk criteria, they will have 12 months of continuous eligibility. We'll have the links to the official CMS press release on those Section 1115 demonstration amendments, as well as the state-specific amendment documents in our episode notes. And for our big story this week, coming in at number 1, on Friday last week, KFF published their 2025 Medicare Advantage Spotlight First Look. This is always an interesting report with some great statistics in it. KFF takes a look at a few different data files here. Most of what we are covering comes from the analysis of the CMS landscape files from 2010 through 2025, as well as the Medicare enrollment dashboard from 2023 to 2024. We'll start out with a familiar number that we've talked about a few times here on the show during AEP. For coverage year 2025, the average beneficiary has 42 Medicare Advantage plans to choose from, and 34 Medicare Advantage plans with Part D coverage to choose from. So about 80% of the Medicare Advantage offerings include Part D coverage. Both of those numbers are down a smidge from what was available to beneficiaries last year. The average beneficiary could choose from 43 Medicare Advantage plans, 36 of which were MA plans, including Part D coverage in 2024. Looking at the total number of plans by type for the 2025 coverage year, we've got a total of 3,699 MA plans. That is down from over 3,900 available in 2024. When we get into the breakdown of plans by type, 2,046 plans are Health Maintenance Organization, or HMO, plans, making up 55% of total MA plans. 1,588 are Local Preferred Provider Organization, or PPO, plans, coming in at almost 43%. And then just 43 plans are regional PPOs, making up just over 1% of total MA plans available. KFF breaks out plan and insurer availability by state, highlighting the average number of plans, insurers, as well as the percentage of beneficiaries with access to at least one plan. Here in Pennsylvania, where Ritter Insurance Marketing has its headquarters, we have a total of 209 Medicare Advantage plans available. PA beneficiaries have access to an average of 71 MA plans from an average of 9 insurers. And then all Medicare beneficiaries have access to at least one HMO and at least one local PPO. So a lot of availability and choice here in Pennsylvania. This is one of the reasons why we recommend portfolio reviews with our sales specialists. They can drill down beyond just your state to your county to really help highlight the plans beneficiaries will be looking for in your market. KFF does have 2 maps showing MA penetration across the country. They've color-coded the states to include the number of plans available in 2025 and whether that's an increase or decrease from 2024. And then they also have a color-coded MA plan availability map broken out by county. And you can switch from viewing 2020 data to 2025 to see the progression of MA plan penetration over the past 5 years. That is a very cool and interactive table. This year, the states offering the most choice in Medicare Advantage are Pennsylvania and Ohio. KFF also included a chart highlighting the counties with the most plans available. And at the top of the list, Cumberland, PA, with 87, and just under that, Dauphin County, PA, where we are headquartered. 85 Medicare Advantage plans total are available. Last thing that I'll mention here, plan availability by carrier. For coverage year 2025, as we mentioned, the average Medicare beneficiary can choose MA plans from 8 different carriers. 31% of Medicare beneficiaries have 10 or more carriers from which to choose their MA plans. 22% have 8 or 9 Medicare Advantage carriers to choose from. 28% have the option of 6 or 7 Medicare Advantage carriers. 15% of Medicare beneficiaries have 4 or 5 MA carriers to shop. 4% have 2 or 3 carriers to choose MA plans from. And then just 1% of Medicare beneficiaries, has just one carrier to choose for MA coverage. Many of these percentages have gone down a smidge since last year, but overall, still a lot of options for Medicare beneficiaries to choose from for coverage. Still quite the need for an agent's help to choose between those plans. In addition to information on plan offerings, KFF also went into more detail looking at plan premiums and benefits, highlighting that a lot of MA plans saw a reduction in those benefits for the 2025 plan year when compared with the 2024 plan coverage year. There's a chart that shows the breakdown of Medicare Advantage plans offering the Part B premium reduction, because that is a benefit that not all MA plans offer. In fact, only 32% of MA plans offer that benefit, far fewer than what some of the commercials on TV would have our clients think. And the full cost of the Part B premium for coverage year 2025 is $185 per month. When it comes to extra benefits available in select Medicare Advantage plans, there is a table showing comparisons of benefit types from 2020 through 2025. That is a great visual snapshot of how much those additional benefits in some MA plans have changed over the past 5 years. KFF also breaks out those additional benefits for special needs plans. That's an interesting comparison as well, to see how those benefits change over time in the general MA plan category, and then in the more tailored special needs plan offerings. There are plenty of stats to review in both of those reports. We will be linking to them both in the episode notes. And that's all I've got for you for this week. If you're going out this weekend to see Wicked, I hope you enjoy it. I will be doing the same, as well as a lot of prepping for the Thanksgiving holiday. We are currently in the middle of a bathroom refresh and a whole house deep clean because we are hosting our first ever Thanksgiving this year. Fingers crossed that it goes well. But in the meantime, I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Tina Lamoureux. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with us wherever you like to listen.